Welcome back. What we want to talk about is that peripheral neuropathy is a sign of a metabolic dysfunction. Your body chemistry not working properly. We will talk about the neurological part in a minute, but we're talking about the metabolic dysfunction. To find out what's wrong, we have to do the proper testing. This is it. It's so crucial. We have to do a complete metabolic profile. That's a blood sugar, hemoglobin A1C. How many of you even had a hemoglobin A1C? That is the most accurate blood sugar test out there. We have to have that. That gives me a look of 90 days of blood sugar. Your vitamin D levels. I bet a huge majority of you are vitamin D deficient right now. Anemias we got to look for. Kidney, liver function. I have to do assessment forms of your neurotransmitters, the chemicals of your brain, see how they're working. You don't think your brain controls your nervous system? We got to look at that. Metabolic assessments. We have to do cortisol from your adrenal glands, right here in your kidneys. Maybe you have too much stress hormone in your body. I know it's the life we live, we can't get rid of stress, but maybe we can deal with it better chemistry-wise in our body. We have to look at your DHEA. We have to look at your immune system, of your guts. Maybe your immune system in your guts isn't working. If that's not working, you're not going to be working properly. I do immune panels. I check to see which side of your immune system is dominant. You have two sides. It should be even. Maybe one side's too high. I got to find that out. Proper testing, folks. I got to test pancreatic antibodies, insulin antibodies. Most importantly, nerve tissue antibodies. Many different tests to test for different parts of your immune system eating different parts of your nervous system. Have to know which one's doing what. What mechanism is causing your neuropathy is what we have to find. Alright? I do stool testing. I look for parasites. I look for yeast, fungus, bacteria. These could all be in your guts, causing all kinds of gut disorders. How many of you right now have bad digestion? Do you know bad digestion and bad brain function go hand in hand? 80% of what your brain is doing right now is not listening to me. It's making your guts work. So if your brain isn't working so good, your guts aren't going to be working so good. And then your nerves aren't going to be working so good. So we got to see what's irritating your guts. Food sensitivity tests. You can be allergic to gluten, soy, yeast, casein, egg. I don't know what it is that you're allergic to, but we got to find out what it is. If you're putting poison in a form of a food that you are allergic to into your body every day, it's going to damage your body every single day. So we have to look at what's going on there. So we have to do all this testing. I know it seems like a lot, but we need to see this black and white. So have you been told that your lab tests are normal, but you still don't feel good? How many of you have this story, right? Lab ranges are inaccurate. These are outdated models. We got to get with the current times. They use bell curves. We need to see functional lab values. By that I mean, here's your traditional lab test. So let's say you have to be between 1 and 10. If you're a number 2, well, you're normal, you're good, Mr. Jones, everything is fine with you. But in reality, you're right out here. You're in the sick range. I want you to be here in the middle. I call it a functional range. I want you to be functionally normal with your lab tests. And that's how I look at tests a little differently than some of your other healthcare practitioners. All right? We have to have you in a functional range for optimal health. I want you in the middle. I don't want you just barely getting by on your lab test, because that's not back. The question you're wondering now is, okay, I know I have neuropathy. I know I have the symptoms. I got the testing to say why I got it. But what can you do for me, doctor? How are you different? What are you going to do for me about this neuropathy? First, running the proper test to find out why you have this condition is not simply just determining diagnosis. I have to use this information to address all the variables of your equation. No two patients are the same. You're all individual beings. You all have an individual case that we have to look at. I have to treat you as a person and not your disease. This is what's getting lost, I believe, with a lot of the patients out there. They're being treated as a number. Stop being treated as a number. You are a person. And stop being treated as just a disease. Okay? We have to find out what's going on with you. Our office is different because we look for every potential cause of your neuropathy. All right? We look for what the problem is and we try to correct it. We will never cover up your symptoms. We will never tell you it's all in your head. We will never tell you just to deal with it. That's not acceptable. Okay? I do not accept everyone in my office, but if I accept you, I can promise you we're going to find the cause of your condition and we're going to give you a treatment program that is going to work to help reduce your neuropathy. This is why the proper testing is necessary again. And when you find the cause, you can then have a solution. This involves the comprehensive neurologic metabolic workup. We talked about some of the metabolic tests we had to do a minute ago. Blood panels, adrenal panels, so all those panels. But we have to do neurological tests, see how your brain's working. I got to see every different lobe of your brain just by doing simple testing, touching your finger to your nose. Can you smell this? Can you see this? Things like that. Completely uninvasive, completely patient-friendly. You have nothing to worry about with this. But we have to find out how the brain's functioning and controlling the nervous system. We will leave no stone left unturned to find the cause of your neuropathy condition. This is the most important thing I want you to understand. We're going to exhaust every avenue and follow that to the end to find out what's going on.